The Boycott Arizona movement continues. Today, the largest Hispanic advocacy group in the U.S., civil rights and labor organizations called for a national boycott of the Grand Canyon State.
The groups pledge not to hold major conventions, conferences, or any other special events in Arizona. From now on, the Williamson County is requiring proof of U.S. citizenship to qualify for its indigent health care program.
The county is also tightening benefits and eligibility requirements for all others in the program. Some charge this is racial profiling, but KXAN's David Scott reports the county insists it's simply a victim of its own growth and success.
Williamson County isn't just cow country anymore. It's doubled its population this decade. Its indigent health care costs have soared 142% the past 2 years. More than 20% of those in the program are undocumented residents. Between that growth, the feeble economy, and 3 new hospitals built in the last 18 months, something had to give.
That means 3 new ERs, and so we've had a lot more capacity than we had in the past. And so I think the combination of the economy plus the new hospitals have really created a demand.
But Latino activists argue that when push comes to shove, Hispanics are the ones to pay the price.
Well, I think that's completely wrong because, again, we've been fighting profiling for a long time, and this is another manner of profiling.
Williamson County says it pays entirely for the indigent health care and that it will bump up against the cap limit before the year is out. And Williamson County is quick to point out that undocumented residents will always be able to get some kind of medical treatment. They will always be accepted at hospital emergency rooms. So eligibility is tightened. The coverage limit per patient per year lowered from $35,000 to $30,000. Still, critics say there must be federal money hidden in there somewhere and want to bring in the Human Rights Commission.
I want to go further than that. I want to go into the federal Justice Department to find out how much money is really being allocated to Williamson County for these one purposes and how this money is being siphoned out.
Still, the county says profiling has nothing to do with the growth spurt or the budget crunch.
This falls in line with what Medicaid requires. It falls in line with the new federal health plan, what they require as well, that it be documented citizens that receive these benefits. They're not going to be cut off from care. If they show up at the hospital, they're still going to be treated if it's an emergency situation. The hospitals are the ones that are not going to get reimbursed from us.
This one could move from the emergency room to the courtroom. In Williamson County, David Scott, KXAN, Austin News.